How do you know if you have diabetes? Type 2 diabetes affects millions of people worldwide. If you have type 2 diabetes, your body is not able to use insulin properly. Insulin is necessary for glucose to get from your blood into your cells to be used for energy. Glucose accumulates in the blood instead of being used by the cells. Often there are no type 2 diabetes symptoms, or they may be mild and go unrecognized. Here's what to look for. Frequent urination. When there is excess glucose present in the blood, as with type 2 diabetes, the kidneys react by flushing it out of the blood into the urine. This results in more urine production and the need to urinate more frequently. If you notice you have to go to the bathroom more often than you used to, talk to your doctor about whether you could have type 2 diabetes. Increased thirst. High blood glucose sets up a domino effect of sorts within your system. High blood sugar leads to increased production of urine and the need to urinate more often, and frequent urination causes you to lose a lot of fluid and become dehydrated. Consequently, you develop a dry mouth and feel thirsty, more often than you used to. If you notice that you are drinking more than usual, or that your mouth often feels dry and you feel thirsty more often, these could be signs of type 2 diabetes. Weight loss. Overly high blood sugar levels can also cause rapid weight loss, say 10 to 20 pounds over 2 or 3 months, but this is not a healthy weight loss. Because the insulin hormone isn't getting glucose into the cells, where it can be used as energy, the body thinks it's starving and starts breaking down protein from the muscles as an alternate source of fuel. Increased hunger. People with type 2 diabetes have insulin resistance. This results in high insulin levels in the body, so, when blood sugar levels plummet, the body thinks it hasn't been fed, and craves more of the glucose that cells need to function. That insulin level makes the brain feel hungry and makes you hungry. Foot pain and numbness. Over time, diabetes can cause damage to nerves throughout the body. Some people may not have any symptoms of the damage, while others may notice numbness, tingling, or pain in the extremities. Slow healing. Infections, cuts, and bruises that don't heal quickly are another classic sign of diabetes. This usually happens because the blood vessels are being damaged by the excessive amounts of glucose traveling the veins and arteries. This makes it hard for blood, needed to facilitate healing, to reach different areas of the body. Blurred vision. The lens of the eye is a flexible membrane suspended by muscles, which change the shape of the lens to focus the eye. In a high-sugar environment such as uncontrolled type 2 diabetes, the lens ability to bend is altered. Although the lens is not damaged, the muscles have to work harder to focus. Blurred vision occurs when there are rapid changes in blood sugar, from low to high or high to low, and the eye muscles have not yet adapted to it. You can find some recommended solutions, like books on diabetes, that describes a lot more in detail and will help you deal with it properly, and some products to detect and monitor diabetes in the description below. Do check that out. Early detection and treatment of diabetes can decrease the risk of developing the complications of diabetes.